Illusions. So, well, why don't we start? So, hi everyone. I'm Scott Podolsky, and I want to welcome you all back to the Department of Global Health and Social Medicine seminar series for the spring seminar, spring semester. Today's a special session representing the book launch for our own Gene Richardson and his Epidemic Illusions on Coloniality of Global Public Health. It's a remarkable read and a challenge to any downstream investigation of inequities or their solutions. And I certainly recommend it to everyone gathered here. Paul Farmer, our department chair, and Cole Catroni's university professor at Harvard, had the honor of writing the beautiful foreword to the book. So I'll turn this over to Paul, who will get to introduce Gene. And my main remaining job is just to remind you to ask questions through the Q&A function for discussion at the end. So Paul, hand this over to you.
Thanks so much, Scott. And thank you, Gene, for both the chance to introduce your book in the written sense and also today. I will keep my comments brief. I just wanted to, before introducing Gene, since so many of you know him, I wanted to just reflect for a second on the shock of the new that I experienced in reading this book more than once. In the middle of an epidemic or a pandemic, we can always see the utility and also the risks of paradigms, because paradigms are models of and for. They cut away the messy circumstances and reality and contingency of human experience, but they're important. And they also have perils that are well explored in Epidemic Illusions. And so I'm going to leave some of that discussion to Gene, and I hope to many of you, including those who are trained in epidemiology and in responding to epidemic disease. I also wanted to say that there is something very precious about pragmatism, and that is easy to sense in the middle of an emergency, whether that's in an ETU in rural Sierra Leone or in a city on either seaboard or in the middle of this country or anywhere else. And, in the midst of those circumstances, and even if we've never lived through anything quite like this, many of us have lived through major epidemics in recent times. In the middle of it, one is tempted always to reach for pragmatism. It's what's most welcome from our colleagues and certainly our patients. But here, I think, is the best exploration of the peril and promise of both paradigms and pragmatism in writing about Ebola. And I say that with some, not jealousy, of course, but humility in any case. This is really a devastating critique. At the same time, it is a constructive endeavor about building a truly post-colonial global health equity endeavor. I will say the obvious in introducing Gene, that the wellspring of much of this flawed logic is colonial rule, and particularly extractive colonial rule, which on the continent of Africa really surged forth late in the game, the global game, as the British called it, and at about the same time that some European scientists were developing revolutionary new tools to control epidemics and pandemics. And Gene's topics, in a sense, collide on that continent as much as any other. And to let him get to the heart of the matter, I will just say that Gene, as you know, is an infectious disease physician, been very active in the COVID response clinically at the Brigham, but has been active clinically in responding to a number of outbreaks, including Ebola epidemics in West Africa and the Congo more recently, but also over long years to drug-resistant tuberculosis, to HIV, and to a number of other pathogens that he has encountered. He trained in medicine at Cornell and did his PhD in anthropology at Stanford, and trained also in clinical infectious disease in California. And since joining the Partners in Health team in responding to Ebola in West Africa in 2014, has been involved in working with that organization, with the Ministries of Health of several countries, the African CDC, and of course has joined our department and also the Brigham divisions of infectious disease and global health equity. Gene, I'll hand it over to you. Thank you.
All right. Thanks so much, Sensei. It's an honor to be here and present on epidemic illusions. I'm going to share some slides. All right. So, book is called Epidemic Illusions on the Coloniality of Global Public Health, and it's pretty well summed up by this revised Harvard shield that used to say truth and now says monopoly on truth and has a confused, is that a griffin? And the idea is that, when it comes to social inquiry, when it comes to interpreting societal events, there really isn't a capital T truth or an objective way of seeing them. There are ways of curating facts and coming to interpretations that often support prior held ideological beliefs. And that can be shown with economics and sociology and anthropology. Here I try to show it with the public health sciences, namely epidemiology. And I'll start, I guess, with the caveat that I'm speaking about epidemiology as a social science. So, if we're talking about, tobacco causes cancer, masks prevent transmission of viruses, these things to me are more physiological, and I'm not critiquing those. I'm talking about when the science is used to make predictions, to describe health phenomena, and we'll get into some examples of that. All right, so I have no financial relationships with commercial entities to disclose, other than my debt to senior faculty in the department for nurturing me and mentoring me. I also saw some former ID fellows on, so shout out to them. And a shout out to my college roommate who's on, Evan Whitfield. He's a visiting scholar in our department, and he's working on anti-racism in professional soccer. All right, we said we're going to get into some philosophical debates. Well, then I'm going to lose because we have the Nobel Philosophy Prize winner. I had shown this slide in December, but Paul wasn't around. So just wanted to, for those of you who haven't seen, Paul won the Gruen Prize, which is kind of like Nobel in philosophy. So hip hip hooray. He's also got a book out for those of you who haven't seen. And here's his doppelganger writing. This is Truman Capote, and they're similar for at least two reasons. One, they like to do lots and lots of rewrites, and also Capote's been known as the finest crafter of sentences of his age, and I would say that for Paul too. The book to me is amazing, more for its sentence craft than its ideas. Its ideas are brilliant too, but it's the vibrant prose is brilliant. So comes highly recommended. So here is my second tier offering. Here's the cover of the book, and the image is meant to be a play or kind of like a détournement on Plato's cave. So Plato's cave basically says that you've got one little cave here. People are chained, they can't turn their heads. All they see are the shadows of these images. Here's coronavirus right here. And someone sneaks out one day and goes up into the sun and says, wow, this is what reality looks like, and comes down and tells them, you've just been looking at images on a wall, reality is up here. And I think a lot of social science, especially econ and sociology, fancy themselves as that. We're trying to find quantitative ways of describing reality so that we can bring people from their blurred images up into the sun. The pragmatist take is that there is no sun, there is no capital T truth. There are only different ways of curating facts and interpreting phenomena, such that a better analogy is a warren, where you can actually go between different caves and find different ways of seeing the world around you. And why would you choose one over the other? Well, oftentimes they're dictated by ideology. And what I show in the book is how epidemiology is a tool of contemporary ideologies like neoliberalism to promote that way of interpreting phenomena around us. For the most part, these social sciences do not promote a radical social equity vision of the world. They're often imbued with neoliberal views. And Salman has a very good book on that called Blind Spot, which I would recommend. So I'll start out with my positionality. As a white male settler colonist or descendant of settler colonists, my aim is not to represent the majority world's experience of epistemic violence. Instead, I'm trying to use my privileged position to expose how harmers do their harm, to show how exploitative and extractive practices are built into what we think we're doing as objective and neutral science. And as far as moral arguments are concerned, I don't think that we are morally related to the ones we've exploited, and we, as in the settler colonists, exploited and oppressed as potential helpers or saviors, but rather, as Thomas Pogge would say, as supporters of and beneficiaries from a global institutional order that systematizes this oppression. So basically what I'm saying is that modern humanitarian work, the aid industry, and a lot of what we call public health science works under this neoliberal notion of aid that we are morally related to the destitute, sick as helpers or saviors. None of them help us, not none of them, but they very rarely help us understand how we are supporters and beneficiaries from an institution that systemizes this oppression. And when you start to expose that, you find that the interventions differ. They move from sending a little bit of aid here and there to, if you take it to its logical conclusion, reparations. And I'll get into what our group is doing regarding reparations in a little bit. So I think the book uses various social theory to make the points, but it really tries to be experimental and not use modernity's terms of reference to critique modernity. But some important definitions or concepts to have it in your pocket as you go through the book. The main one would be coloniality, which can be described as a matrix of power relations that persistently manifest despite a former colony's achievement of nationhood. Framework attempts to capture the racial, political, economic, social, epistemological, linguistic, and gendered hierarchical orders imposed by European colonialism that transcended decolonization, so transcended independence movements, and continue to oppress in accordance with the needs of capital accumulation. Another way of describing it is that the heterogeneous and multiple global structures put in place over a period of 450 years did not evaporate with juridical political decolonization or independence of these former colonies over the past 50 years. We continue to live under the same colonial power matrix. Instead, we've moved from independence from global colonialism to the current period of global coloniality. And Sabelo and Glovo says, despite the celebration of decolonization as a milestone in African history, Africa has not managed to free itself from epistemological colonization. So this is inscribed on the continent and its people by mission and secular schools, religious denomination, schools of medicine and public health, and other institutions that carry Western cultural imperialism. And what I argue is that one of the more important ways people are colonized is by colonizing their perception. So it's similar to almost, but not as this is more a drastic example, but it's sort of similar to what happens on Facebook. Facebook, you're on Facebook, your attention is the product for some company, and they pay Facebook to grab your attention, but then also to introduce like subtle ways of changing your behavior, usually towards buying people's stuff. Coloniality of perception is a much stronger version of that. And Lova says the most important area of domination was the mental universe of the colonized, the control through culture of how people perceive themselves and their relationships to the world. And I think that's very important, because the way that our global public health sciences work is that we often tell people how to interpret the health phenomena around them, how to interpret their own suffering. And so an example I use in the book, which I won't go through here, is of a Harvard School of Public Health study that came in to DRC when I was there, and basically produced an article that made it into Lancet ID that concluded people had their own ignorance, their belief in misinformation to blame for the widespread transmission of Ebola there. There's nothing about legacies of colonialism, Leopold cutting off of hands, the US colluding in the assassination of their first elected prime minister, Patrice Lumumba, and then installing the Cold War puppet Mobutu to allow the rest of the country to be ransacked by our transnationals while they propped him up. None of that comes into how people, came up with this perception that Ebola either isn't real or is some kind of US bioweapon. All they had was their inability to accept fact. But all you had to do was go, be there and talk to them and sort of go through some of the historical stuff. And you see that those beliefs are very much tied to these colonial legacies. And so when the article that says they're ignorant gets published in Lancet ID, and my article gets published in Medicine, Anthropology, and Theory, which no one's ever read, you can see that even built into academic structure about what gets conveyed as knowledge or a proper legitimate interpretation is already hierarchied into, for me, it's not quality of study, it's does it support neoliberal approaches to the world, and blaming people for their own the individualist argument, blaming people for their own suffering is a very neoliberal view. Not only that, but if you take the legacy of colonial view to its logical conclusion, and you start to get to reparations as an intervention, then you start to question where the wealth came from in the first place of the people doing the studying, and that that's where it gets anathema. No one wants to give you grants to say that we need to tax ourselves and pay reparations a whole lot more. So cultural hegemony is another term. If exploitive socioeconomic relations are indeed foundational to the social order, which they are in the US and to global North-South relations, then it's likely to have a fundamental shaping effect on social ideation, including the production of social scientific knowledge. And that's why I think you'll see almost pretty much any form of social inquiry, you can see the ideology built into it. You can see the ideology built into mine. The ideology would be radical social equality. For the most part, though, the stuff that gets main published, it'll be easy to find protections of global North affluence built in. So I've called these studies a form of bourgeois empiricism, and Levins and Lewontin had paraphrased them, basically models of disease causation that obscure socio-historical forces. So models of disease causation like Ebola and DRC that say you're ignorant and not that there's Leopold behind it, so it's obscuring socio-historical forces. They are themselves political acts. These scholars should know better. They should know that there's legacies tied to it. And it gives, so they're political acts that give support to social structures that hide behind scientific objectivity to perpetuate dependency, exploitation, racism, elitism, and colonialism. I guess what I found is that, when you meet the people, they're not racist at all. They're actually like good, caring people. You go down the line and you see that the tools they use have kind of racist inclinations built into them. And I'll show some of the paradigms of epidemiology, but for the most part, they're very conservative. They often only allow for downstream analyses, and that in itself obscures the upstream stuff. But it also cuts out implementing upstream interventions. Another term or concept, symbolic violence, it can be thought of as the capacity to impose the means for comprehending and adapting to the social world by representing economic and political world in disguise taken for granted forms. So again, with the Congo example, that I think the narratives of mistrust paper is a form of symbolic violence because it sort of just takes the social forces that have sculpted the views for granted and imposes this way of seeing things. And it really took on. I was there, I'm at WHO meetings, and you start to hear Ministry of Health people, WHO people saying, oh, we can only combat this misinformation. Let's start to get WhatsApp groups with cheats on them to like help spread the information better. To me, that might help a little, but really what, the reason that there is this habitus of distrust and eluding depredation is because of these legacies. The same thing in the US. We had a horrible containment campaign for COVID, but you can't blame it on Trump and all the misinformation. Even if Biden and Rochelle and them were in at the beginning, we'd still have 1,000 deaths a day, just like Germany, who's done very well, but still has a lot of deaths. There's something about the global North elite that there's a bit of a habitus of entitlement, right? Of racism, of thinking that the individual can do what they want to do. And so even if we had the best leaders in place, we would have still had a bad epidemic. A lot less people would have died though. So, those excess deaths are all at the feet of our inept previous political leadership. But again, and this goes back to, old anthropology studies. Like, when does witchcraft show up? When does this, misinformation, belief in misinformation shows up? It shows up when equality gets out of whack. And so it's not, you could have easily predicted that the countries with the worst outbreaks were going to be the ones that were the most unequal. And so we have the US, Brazil, South Africa, India, Russia as having the biggest outbreaks in the world and being some of the most unequal societies. Because there, it's not just misinformation shows up, it's mistrust that's engendered by an unequal society. And so you got to repair that inequality, not just get Rochelle on the horn, because Rochelle's amazing. She's not going to be able to solve all of it. So some other techniques I use in the book, I kind of base it on, instead of a methodological individualist approach, in social science, we would call it a methodological relational approach. But this so-called methodological relational approach was done way back. Buddhism is a good example of a methodological relational way of thinking. This happens to be when I did my master's degree in Asian studies, I studied this particular form of Buddhism, Huayan, which is a more philosophical predecessor of Zen, and really helps you to try to explore radical relationality through things like koans and that kind of stuff. And I have a koan in the book. I make use of détournement, which is kind of like culture hijacking. I don't know if you ever read the magazine Adbusters way back in the day. A similar sort of thing I do in the book, like taking known products, like media products or scholastic products, and changing them in ways that don't really use logical argument, just sort of let you use the paradigm you were used to for understanding this. And the paradigm for the first one is that, virus causes sickness, and when you get sick, you go to health center, and like that is what Ebola is. And here, the other poster is Here's what Ebola is. It is actually just a surface manifestation of these historical legacies like purposeful underdevelopment, barbaric colonialism, the Holocaust of slavery, structural adjustment, epidemic violence, and illicit financial flows. This is sort of another form of détournement. I do a fake journal article called the Race Prep Study. And I essentially model what for Black women at high risk of HIV acquisition in South Africa, model what race change would do and compare it to PrEP, which is pre-exposure prophylaxis, in this case of dapivirine vaginal ring. So, you know, control group, basically, there's 8% incidence in high risk areas. So 8% of all women every year in high risk places in South Africa get infected. The dapivirine ring brought that down by 25% or so. So here's what that looks like. But race change, essentially giving Black women the structural elements that white women have would bring it down to like 0.1%. And so, departing from imperious irony, it's incoherent, of course, to imagine people switching their race if race is conceived as an intersubjective construct of social practice, institution norms, and expectation. Rather, though, it can serve as a heuristic device that's used to demonstrate the conservativity inherent in causal inference as a paradigm. Because with these modeling studies, it's really only the well-defined interventions that you put out there, like randomized trial of dapivirine. But there's no, and so you're left with just a chemical solution, which we need there. But there's no way of coming up with a intervention that would sum up all of the structural elements that that go into why Black women have a much higher risk of HIV acquisition than white women do. Only race change could do that. And so I modeled it to show that, to basically show that it's absurd to produce this model. But then again, it's also absurd to not realize that any model that you use the really well-defined approach is going to be very conservative. And because those are the ones that get the published in all the journals, we're only left with interpreting interventions into these diseases in very downstream ways. And so the idea of this article is to sort of explode that notion that, we don't just, these modeling studies should be 10%. They should shine a very small light on what's going on as far as the health phenomena and suffering concerned. There was another article that a colleague, Amy Maxman, wrote. She's a journalist. She wrote about a journalist with a PhD from Harvard, who wrote about the women in South Africa. And the quote at the top is, if we could get rid of these blessers, there wouldn't be a problem. And the blessers are kind of the sugar daddy. So it's already, you get from the mouths of the people that are suffering that they understand it's a phenomenon where they can't get jobs and they're forced into economic transactions with their body that put them at risk. And that if there was only some form of reparative justice that allowed either jobs or cash transfers to come their way, there wouldn't be any need for this dapivirine stuff. But that stuff doesn't make it into any of the global health literature. I mean, because either it's too pie in the sky or it's too political to say that there should be a reparations campaign to address the legacies of apartheid. Well, we have a group that's doing that. But the point of the book is to show these things that, what has come to achieve cultural hegemony in the world of epidemiology, from big data to causal inference to regressions, they all do very conservative things. And they all have, and they thus have, they are thus ideological in what they, promote to the world. Another thing, so here's from one of the pre-appendices, here's the R code for those graphs, just to show that, if you think like I do, that models are fables and they are just ways of trying to envision a social imaginary for what may come, then they are forms of rhetoric. This is not, 2 quarks or 3 quarks make a proton, because that'll always happen regardless. And this is not, let's try to get 1 quark by itself, because you can't do that. This is there are many ways of envisioning where we can go with our future. And the ones promoted in contemporary journals of public health are very limited in their social imaginary. Some other things I talk about in the book are the gentrification of knowledge production. So, you don't just gentrify cities and take away historical buildings and put up new things so that you don't even know what was there previous, like look at Fenway. You can gentrify knowledge production too. And so Kwame Nkrumah in the 1960s in this book was already talking about how aid is a revolving door for, giving countries a little bit with one hand to disguise the huge amount that's being taken with the right. I learned about this phenomenon from the Anti-Politics Machine and then read Nkrumah afterwards. And so I was pretty surprised that a book written 30 years prior to this one didn't have, was not even cited, and pretty much had the same ideas with a Foucauldian spin. To me, that's like the perfect example of gentrification. You've had a little facade, but you've taken the core of it and adopted it as your own and are selling it for more money, essentially, or more academic capital. All right, so getting to the instruments of epidemiology. And to me, the instruments are the actual epidemiologists. So the role of the intellectual, as Foucault said in an interview with Deleuze, is to no longer situate himself slightly ahead or slightly to one side in order to speak the silent truth of each and all, right? That's sort of the social scientist that can walk out of the cave and go see the sun. But rather, it's the struggle against those forms of power where he is both an object and an instrument. And I think that is the huge problem here, that most people working in social science do not struggle against the forms of power of which they are an instrument. And one other quote from Ruha Benjamin, human toolmaking is not limited to stone instruments of our earlier ancestors. Human cultures also create symbolic devices. And that's what I'm interested in symbolic power. A little bit more conceptually, so epidemiology is dispositif. So dispositif is like an apparatus. Foucault talked a lot about it, but I like Agamben's extension of his definition. So further expanding on the already large class of Foucauldian apparatuses, I shall call an apparatus literally anything that has in some way the capacity to capture, orient, determine, intercept, model, control, or secure the gestures, behaviors, opinions, and discourses of living beings. So, from the Congo example, it's easy to see epidemiology as dispositif. It tries to capture the way people see health phenomena. It orients them to a more individualistic view instead of their critique of legacies of colonialism. It determines behavior then, so they have to basically get knowledge instead of create reparations campaigns. And then you move on to modeling, which I'll get to, which also helps to secure people's gestures and behaviors because it gives a social imaginary of what our future could look like. Four of the paradigms that I talk about in the book are causal inference, big data, regression models, and epidemic modeling. If you want a quick sum up of how causal inference is a politically conservative modality or methodology, I highly recommend Sharon Schwartz's article in Social Sciences Medicine from 2016. And in the rest of the talk, I'll go a little bit into meta-regressions and epidemic modeling and how those do ideological work. But I'll reiterate how I see mathematical models. I find them merely fables dressed in formal language that therefore create the illusion of being scientific. For the most part, they serve not as forecasts, because they're almost always wrong, but rather as means for setting epistemic confines to the understanding of why some groups live sicker lives than others, confines that sustain predatory accumulation rather than challenge it. And this article here is basically the afterword of the book, so you can look at either one if you're interested in. All right, so let's talk about some models and the awful work that they do. Here's spatial and temporal dynamics of superspreading events in 2014, 15 West Africa Ebola outbreak in PNOS. So this don't let them fool you with the super spreading events. They use the word super spreader over 20 times in this article. And here is the NBC article that was written in response to this. Super spreaders drove Ebola epidemics finds, and with this picture. So we're using symbolic power to, like, what work is being done with this? To me, the work that's being done is this guy, this suffering guy who's you know, at the base of legacies of colonialism, neocolonialism, structural injustice, institutional international racism, is getting blamed for spreading lots of disease and getting exposed for it by an article in PNAS. And, you know, they basically refer to him as an Ebola patient and a super spreader. And I'm interested in symbolic power, like what we call things. What if we thought of this person as not an individual, here's the radical relationality here, but as a node in a network that is a PPE bereft care nexus. So, you know, when you think of him like that, he's part of a network that it was in the setting of a poor health infrastructure with no PPE because of purposeful underdevelopment by the global north, but then is also forced into care relations and gets sick that way. And so this is just a little example of like what I think the harm that can be done in representing and different ways of representing that you know, may be more just descriptions. I talked about this one in December, so I'll go through it a little quicker, but you know, IHME, or Institute of Health Metrics and Evaluation, is such an easy, low-hanging fruit to show how their output does racist work that I'll just go through it quickly. But here's a good quick article about our Bill Gates's billions distorting public health data. So they've given 600 million to IHME, who are the premier epidemiology group in the world. And they put out some COVID forecasts, which were completely wrong. So the true number of next day deaths fell outside their 95% confidence intervals as much as 70% of the time. So they were wrong if you want to think of them as wrong. I think Nassim Taleb, who I'll show you a paper, would say they're not even wrong. Anybody that tries to get point estimates on these fat-tailed variables, even if they get it right, they're wrong, because they're dealing in such uncertainty that they were just kind of lucky to get it right, or to get the accurate number. But even more than being wrong or being not even wrong, the plunging IHME projections were used to endorse Trump administration's COVID-19 response as competent and effective. So you could look at, they're just like Ebola, COVID had everything from, like, you know, John Ioannidis saying there'll only be 10,000 deaths total to Imperial saying there'll be 30 million deaths around the world. So you can pick whichever one you want to support your ideological views. And in this case, these were used by Trump. Here's the paper I'm talking about. Taleb has a good back and forth with John Ioannidis on whether models are useful. And Taleb's view, which I support, is that they're not useful at all because there's so much uncertainty that you should be using all resources to take the most paranoid approach possible, which was basically what South Korea and China did. And they had small outbreaks. And then you could look at England, which decided to model and see where things would go, and then let themselves have a big outbreak. And now it's too big to catch up with. So an even bigger point, though, why I find these models problematic is that they endorse a future where COVID disparities continue to exist. Institutionalized racism is rampant, hyper-incarceration is ongoing, and universal health coverage is denied. So the social imaginary that they give us, the future that they give us, is either, you know, you're going to have 3 million cases, and there's still going to be overrepresentation of people of color, and it'll look like this if we don't do masking and social distance. If we do masking and social distancing, we'll have a lot less cases, but there'll still be the disparity. Like none of them build in the interventions for these disparities, because it would mean some form of reparative justice that either they feel is too political or is kind of outside the well-defined variable paradigm, or is just, and here's where you start to think about, like, is it, I personally see IHME like the Hoover Institution at Stanford. It's a conservative institute. It's funded by a billionaire who was a monopolist back in his day, really worked hard for the Microsoft monopoly, and now works hard to, undermine things like TRIPS and promote intellectual property instead of allowing, global South countries to be able to manufacture generics in health emergencies. So the deeper down the rabbit hole you go, you can see upfront the ideology built in. But for me, I'm just looking at surface results, the ideological work and racist work they do. And so in short, they actively delimit through their exaggerated precision, right? This scientific precision, even though they were completely wrong, and acceptance of government interventions as status quo, just mask, just social distance, nothing about reparations, let's say, the public's ability to imagine social alternatives. And so to help imagine social alternatives, we created this Lancet Commission on Reparations and Redistributive Justice. And our report hopefully will come out in a few months. But one thing we've done on the side is to make an attempt at some anti-racist modeling. And I'm not going to go through it because I did last time. But for those of you that are interested, it's up on medRxiv, preprint server, medRxiv. And hopefully it'll be out in Social Science and Medicine soon. We're on our second review. So let's look at how meta-regressions also do ideological work. So this is the same group, IHME, Global Burden of Disease Study. And you look at this and they basically, their conclusion is that the global burden of deaths and suffering in the world, the three main determinants are, is it alcohol, tobacco, and either diet or like indoor pollution, something like that. So you basically have those three reasons to explain the majority world suffering, the majority world being the low-income world. And so the analogy I'd like to make is that this is like saying, and their stated mission is to improve health by providing the best information on population health. So to me, it's somewhat like saying you go into 1800s America and you count and report how many enslaved people died from strokes, heart attacks, malnutrition, whatever, alcohol, publish that and say, okay, we're improving the health of American slaves because we're reporting the best data on their final cause of death. When you have no analysis of power, then you collude in it. Such that here's Seye, who is he's the editor-in-chief of BMJ Global Health, tweets, is it ethical to publish estimates from Global Burden of Disease Study? I don't think it is, because this is the work it does. It basically autoclaves imperialism's backstory for any explanation of suffering you go to around the world. So yeah, essentially the book ends up saying that, you go through all these things. If you trace human rights failings to the impoverished discursive infrastructure of objectivist epidemiology, then we can transform global health by transforming its representations. And with that, I'll end. Thanks so much. If you have any stuff you want to send me on the side or for discussion afterwards, feel free to email me. But otherwise, we'll open it up for discussion.
Gene, thanks so much. And we do have a few questions already. Paul, I wanted to give you the chance. Did you want to respond first?
I really would love to open it up. I mean, I find these examples as they're meant to be bold, provocative, illuminating, and I'd love to hear more from our colleagues trained in the sanitary brigades.
Fair enough. All right. So, well, first we'll give a softer ball to Gene. So there are a few questions already. One is, how did you become a person who believes in radical social equality and decide to focus your work through that lens? How can we scale your transformation to change narratives, paradigms that most people operate in?
Yeah, interesting. I should pull up the I just got interviewed by NPR about the book, and questions like this come up a lot. And let's see. So I guess how I made the change. I mean, I don't know. It's like Paul sort of describes it in the introduction. Like I just grew up as a middle-class white kid that parents were upwardly mobile and had no clue about anything. And then I think I finally got to around college and just started experimenting with truth and things like that, and read Infections and Inequalities and said, wow, okay, this really pulls all the radical relationalism I've been feeling in my head, but gives me sort of pragmatic outlet for it. So you can see there's a lot of modeling my action career on what I learned from Infections and Inequalities and Pathologies of Power and whatnot. And then the article about like, well, how am I then using this sort of, my position of privilege? I wrote, I have an opportunity to strategically deploy my position within elite, historically racist institutions in order to scrutinize how they do harm, whether it be by extracting academic capital or by supporting racist neocolonial structures that perpetuate predatory accumulation. And while I do fit the category of white upper middle class male extractivist, my goal is to gather resources in order to bridge the historical divide between the ivory tower and grassroots advocacy, utilizing the convening power of the former to decenter it as a sanctioner of legitimate knowledge production. And then as such, through efforts like the Lancet Commission, we're building teams of academics, activists, donors, policymakers to try to synergize these efforts to achieve radical social equality. So nothing that Paul and Friends and PIH hasn't done before. I mean, the thing that I focus on a little more, I think, is how symbolic violence is perpetuated instead of real raw material deprivation, but both contribute to destitution, and so I hope that sums it up.
Great. All right. Well, there's a lot of friendly fire here and friendly support. Here's do you have any advice for what we can or should do differently at the individual level, us being the individuals, especially for those of us who are implementers in global health, while working within our institutions, and their limitations? How can we be active agents for change?
Yeah, I mean, I think when you get to the policy goals, taxing the super rich and reparations, and to pay for reparations, to me that was like an end goal that would policy-wise get us to, I think, this goal of radical social equality or closer. But in the meantime, what are you going to do? I mean, you're a doctor, a nurse, you're going to take care of patients. Like I sort of see those things as forms of transitional justice while we try to get to the big policy measures that achieve equity. So yeah, continuing to organize, continuing to work for those policy goals, but then doing your good work of whether it's academic or clinical in the meantime, as kind of thinking of it as transitional justice while we're trying to get to this equitable place.
And it does get the question that you and I've had before about how we teach medical students, right? In a course, say, on social medicine, at what level should they be taught?
Yeah, well, I mean, I think they should be, yeah, that's a hard one. I mean, I would always go toward the more radical side of things, but sometimes when you go that route, you end up throwing out babies with bathwater. So it's also really good to just see lots of examples, which you guys do a great job of people doing, whether it's academic work on like Gene on NCDs, or whether it's people working on healthcare for the homeless practically, or whether people doing PIH missions. There's lots of different ways people try to kind of operationalize their view of getting to social inequality. So I think for the students, yeah, just seeing the huge variety of examples, and then they can follow up with people that oh, this person's more interested in coloniality, or this person's more interested in that like more practical humanitarian stuff. So exposure, exposure to different approaches.
And we certainly wrestle with these upstream, downstream explanatory models. The early question had been, how do we as implementation researchers ensure we publish our studies in anti-colonial ways and means?
Right, that's a great question. So the first, I think the first measures are, as like Bethany and colleagues have shown, right, is um, prioritizing global health scholars for the work they do and not letting them get either stuck in the middle of authorship or not on the grants, or not in elevated to some of the policy positions in like UN bodies and whatnot. But to me, that's still a lot of surface stuff. If you're still doing downstream variable regressions or causal inference, that the paper I critique in the book is one that shows that people that start ARVs in South Africa cause their homes to become more food insecure. It's like, oh wow, like thank you for telling us that hungry households need food, instead of saying something like trying to work on a project like land reform as reparations for apartheid could reduce HIV incidence from 8% to yada yada yada. Like being clear about how limited these approaches are and how downstream they are, and trying to expose what ideological work they might do when they're published. I mean, I'm guilty of all these things because I'm trying to gather academic capital and I've done regression papers and whatnot, but I always try to smuggle in the discussion these kind of ideas. And sometimes the editors will find them and like stomp them out, but oftentimes enough, we at least get to use the discussion as a promotion of why this is not the best paradigm, or it's only a tip of the iceberg view, such that a bigger, better project would be to, et cetera, et cetera.
All right, and that gets to the next few questions, which are really around these issues of methodology and framing. And here we will be hearing from the epidemiologists. And one is, I'm trying to imagine how this critique would be heard in the Department of Epi at the School of Public Health. I don't think they would recognize their own work in this description of what epidemiology does. Nancy Krieger would certainly object. What would you say to or about her?
Well, I have presented to the American College of Epidemiologists, and it went over well enough. I think I focused more on just how can we reform the methodologies to try to get to more upstream things, to be more cognizant of it. And I was just invited to give grand rounds at the Columbia epidemiology grand rounds at Columbia. So it's not like there aren't epidemiologists that are interested in it. I think if you take me for my word, I'm pretty critical that there needs to be a radical transformation of the methods and not just the reformist stuff. For Nancy's stuff, I guess, yeah, she's done great work on racism and whatnot, but I still think she uses the modernity's references to critique modernity. So you're still kind of perpetuating a paradigm that is sort of the cause of transnational inequality in the first place. This sort of like perpetuating Western social science as a dominant way of interpreting the health phenomena. And I think their response would be, oh yeah, all we have to do is get, we don't have to talk about causal inference. We can just get a little more upstream. And it's like, I don't think you can get upstream with that. I don't think you're going to prove, you're ever going to show a causal link between hands cut off in DRC and an Ebola outbreak 200 years later. I think we need to get to a place that people saying they think Ebola is not real or a US bioweapon and having discussions with them is enough of a critique, enough of an explanation of what is going on, than trying to get somebody to do some historical causal inference model that ties like rubber extraction to Ebola outbreaks, because you're never going to do it. There's the variables that far back are not well defined. So I still think, while that work is a step in, social epidemiology is a step in the right direction to help us interpret things, it's still, it still perpetuates this sort of culturally hegemonic process whereby Western means of interpreting phenomena are the ones that still should get the cachet, even if we reform them. And I want, my view, and I think a lot of global South scholar view, is that if you're thinking things are pluriversal, then it's just one little way that has no more power, like explanatory power, than some folk model. As long as the folk model is a way of curating facts instead of, but either way, they end up all curating facts in a way that lead to interpretations. It's just a good example of this is there was a Harvard disinformation study. I don't know if you saw, that came out about, it's been in all over Twitter and whatnot. Basically says that the American descendants of slaves people on Twitter they've been like selling misinformation to undermine, to disenfranchise Blacks, because if the Democrats aren't going to give reparations, then we shouldn't vote for them. And the paper itself was extremely, it just took a political position and summed it up by, supported it by like, look at all these tweets we scraped that support our view of things. And it was really just hiding behind some sort of like objective counting, even though it was calling itself, it's basically using the hammer of social science and machine learning and all this kind of stuff to say that our view has more objective place than these people speaking on Twitter, because we used all these quantitative methods. And really they were just having a political argument, which I think is anything we get to as far as social phenomena is like, how do you see the future? Where do you want to see it go? What methods are you going to use? And are you going to be more conservative in those views, or are you going to have radical social justice? And so I think it's hard for people that are still immersed in hardcore epidemiology to get to the radical stuff.
Great. There are a ton of questions coming in, and some of these relate to those questions, including from Molly in here, but we'll get to those. I've heard that Arthur would like to ask you a question. So Arthur, I'm going to make you able to speak. Hang on one second. Let me get into that. Arthur, you should be able to speak now.
Thanks. Can you hear me?
Yeah, absolutely.
Yes.
Well, Gene, that was terrific. That's probably the best presentation you've done, because it was the fullest, I think. I agree with a lot of it, but I want to be the devil's advocate here.
Sure.
So just to open things up a little wider and say, maybe you're not going upstream enough. You're going way upstream, but maybe not enough. So my late neighbor was one of the world's great historical sociologists, Barrington Moore. And Barry Moore produced a book which anyone interested in your subject really should read, which is called Hierarchy and Inequality. And using all the historical sources available to him at the time, Barry argued that short of a few, and just a few, small-scale pre-literate societies of groups on the order of tens or the most 100, as you scale up societies, there's no historical evidence that any large-scale society has ever existed that hasn't had hierarchy and inequality. And so I'm wondering if what you are describing is simply one dimension of hierarchy and inequality, a very important one to be sure, and one that is currently one that we're very involved in, and rightly so.
Yeah.
Is there something before coloniality, before colonialism, that is still there, that represents some fundamental dimension of the organization of large social structures?
Yeah, thank you. Great question. I mean, I think this really helps me convey that, as a critical pragmatist, and, if you want to read about critical pragmatism, get Arthur's book on A Passion for Society, that, the views that I am trying to join with people that I think are most just, in 10 years from now will be seen to be, you know, not as just, because people have thought about it more, and, you know, more subaltern voices get to the table. And that's how pragmatism works, that you could continue to agree on things, that ways of seeing the world, and hopefully they get more just as they go along. Yeah, and you're right as far as the examples of radical social equality. I mean, if you look at an example today of, okay, well, where's a good country where they have, good socialism? Do we want that? You know, you could pick Norway. So, okay, yeah, Norway's got some nice socialism, but they're also poisoning the world with all the fossil fuels they sell, and then, living off of the national fund that they get from it. So they're, while they may in this little tight circle be practicing some radical egalitarianism, or not radical, just some better egalitarianism than other countries, they're destroying the world's ability to actually exist in the future. So that does not show recognition of radical social inequality. So I do think that's why some of these new paradigms of like degrowth and green economies are coming to the fore, because there will be no way of achieving these egalitarian goals without degrowth. There's no way we can continue to consume and still have a planet in the future that allows for as many people to live more or less in equity. And so I think that, to me, I'm sort of moving into that kind of work. Like, how does degrowth contribute to these visions of like where we want to go as a society? But it also would mean like, transcending a lot of the nation states' ability to do things within fictitious borders, which is just so much radical change that that you may think it's not possible. But I think that's part of it's called capitalist realism, right? That there's such ideology pervading what we do that people can't even imagine an outside of it. And it's the same sort of argument I make with IHME. It's like there's such a pervasive view that these are the interventions, that these are the variables that are determinative, that we can't even like think out this beyond that box, that reparations might be something that is actually a public health goal. And so yeah, that's why I work on this sort of philosophical stuff, because I think busting through these epistemic confines, whether it be capitalist realism or like epidemiological realism, are what we need to like broaden the social imaginary so we can get to some of these equitable places.
Can I just weigh in for a second? I'll hand it off to Scott. Alicia asked a question along those lines. I'll just summarize if you can't see it. As a human rights lawyer, sometimes human rights can be just another cave in the world, which also replicates the same paradigms, coloniality and neoliberalism, in historical, apolitical, but slightly different ways. Can you talk a bit about the Reparations Commission and how you're pushing human rights beyond its own comfort zone? Thank you, Alicia.
Yeah, thanks, Alicia. I just got to meet her. She's doing brilliant work. And yeah, so the Lancet Commission, we basically have a group of 10 sections, and they're all led by people that would benefit from the reparations they're writing about. So there's no, there's no reparations for me. I'm just sort of a convener. And so we have topics from reparations for descendants of people enslaved in the US. Joe Gahn is the section head for Native Americans and historical trauma. We have one on Caribbean slavery and genocide, women victims in armed conflict, climate justice, Congo, reparations, apartheid in South Africa. Am I missing anybody? Oh, and Salman and Jason are working on reparations for structural adjustment, which I think is going to be a good one. And so the goal there was to just use the Lancet as they publish all the IHME stuff. So I'm thinking to myself, all right, well, if I'm going to be true to my word, how do I get them to kind of expand the social imaginary? So I talked to Richard, he loved it. And the goal is to kind of use this clinical journal platform to expand the notion of what it means to do global health. And then once we publish the report in the next couple of months, the goal is to then use it as a springboard for not only other people doing research on essentially documenting atrocities and then coming up with what reparations would look like, but supporting the grassroots movements and advocacy movements, like I talked about earlier in the talk. How do we start bridging this ivory tower divide? Right now we're looking at it like raising money for a program on global and ecological justice so that we can fund a scholar in residence, Evan as a skull activist in residence, or activists in residence, grants to grassroots groups working on reparative justice, so we can find the synergy and keep what we're doing, just out of the ivory tower, which is a real risk, right? I mean, it's kind of what happens to a lot of it, and then I can already see myself being pulled into it. So, yeah, those are the goals of the commission, and then to grow it into a much bigger network.
Along those lines, Danielle Domersante asks, how do you advise reparations to be conducted in post-colonized systems / countries so that said reparations serve real and sustainable change?
Okay, great question. Yeah, obviously it's like not me making the recommendations, because I'm just trying to use my position to convene and to help subvert. But what our each section leader has come up with, it varies a lot. So the U.S. Descendants of Slaves one is people enslaved is going to be, they're interested in really just eradicating the wealth gap, which is between blacks and whites, and that is $12 trillion, or $10 trillion. So that $10 trillion divided amongst 30 to 40 million descendants of people enslaved in the US as a check. And they have their own reasons of efficiency and whatnot for that, even though they've thought about different things from like baby grants to universal health care to free education. In South Africa, they're looking at more, instead of direct cash transfer, land reform. So same thing they did in Zimbabwe, retaking the land that was stolen by white farmers and distributing it amongst black citizens. In Congo, it's more of a reparative monetary thing from US and Belgium and some nearby countries for some of the Great Lakes Wars. Climate one is going to be, I guess, I haven't really read their recommendations yet, but it probably won't be in the form of checks to countries in the global south, but informing policy that really forces the rich countries to really dampen down their output, but allows some carbon reparations, right? The lower countries to produce more than they would be allowed by certain targets so that they can industrialize and then back off. So there's a variety of ways of doing it, and the different sections are employing them. I don't know, is Joe on? Joe could speak real quick about his section. I think he might not have been able to make it. So yeah, and hopefully it'll be out in a few months, so you'll see it in full.
Perfect. All right, so some trickier questions. Here's someone, Brandon Istens is citing Paul. In Pathologies of Power, Paul writes that concepts of cultural relativism and even arguments to reinstate the dignity of different cultures and races, quote unquote, have been easily adopted and turned to profit by some of the very agencies that perpetuate extreme suffering, unquote. By extending your critique of objectivist epidemiology, empirically founded critique, to a critique of, quote, objective truth, unquote, in general, do you give ideological cover to those who use relativism from positions of power?
Yeah, good question. So I think that's the trap. If you go down the route I'm going down, that you could end up in cultural relativism, and then it's like, anything goes. And the way out I see is through Dewey and James and Rorty and Arthur, the critical pragmatism route. That there is actually lines you can draw. There are not objective, but semi-objective stances you can take, and these are based on what we come to agree upon as humans in the least sort of oppressed state that we can find. So it's sort of like the Habermas, ideal speech situation, but it's when people are unconstrained in their ability to communicate because of a lot of these these forces that are already there. What sort of ideas would they come to about interpreting phenomena around them? And that's the line you draw, and that becomes true. And so it's not really cultural relativism; it's critical pragmatism, and there's a difference because the pragmatism allows for lines to be drawn in the sand, but they're about the consensus views of interpreting the world around us.
We'll shift another 90 degrees here. This is from Molly. Thanks, Gene. Can you clarify why you feel that the tools, and this goes back to the issues of epidemiology, why the tools are the problem as opposed to those that implement the tools? In fact, statistical models can be used to study the effects of addressing structural inequities, i.e. the expected benefits of reparations on health that we just discussed. I agree there's a problem with narrative and who controls the narrative, but I see the problem as related to the research questions being asked and the contextualization of findings rather than the statistical tools.
Yeah, right. And I agree for the most part that it really, tools are not the, active agents, and they're often just in the hands of people that want to do good upstream work but aren't getting grants for it because that's not like the sexy form of modeling that's out there. But I still think there's only so far you can go. I think the Sharon Schwartz article really lays it out there. That the causal inference paradigm, to me, it is achieving cultural hegemony in epidemiology as becoming, with big data, one of the dominant ways that we train our young epidemiologists and send them out in the world with this is the tool they're equipped with. And I know that because as part of my anthropological participant observation, I've taken the classes more to watch what they're learning and sort of see the homework they're doing. And I see how they're being programmed. And when you're programmed with causal inference as one of the best tools, yeah, it's scientific, but it really can only answer very, very downstream things. And so to me, there's no hope for causal inference being used as a tool of exploring structural determination. But it's not like there's a field of structural determination. Like that is too wishy-washy, too fuzzy to be a paradigm because it's doesn't have the scientific smell to it. And so, while I do think a lot of the time it is who's been programmed to use the tools, I still see certain paradigms as having very limited ways of shining a light on phenomena. Same thing with big data. We're never going to get to where big data has like the Google view of every input is there and all they have to do is look at it. There's no more need for social theory. So I think there are limitations to the methods as well. Regression, I haven't found a regression yet that I couldn't substitute variables, and these are socially behavioral ones, not like, again, tobacco causes cancer. But I haven't found a regression yet that I couldn't find variables and really substitute and tweak the answers just based on how they were chosen.
So do you think there are questions that could be framed that would bridge these two disciplines, these approaches?
I think Epi has a lot of power. It's just the very narrow power, and it needs to be recognized. When it tells us that the masks are helpful or the tobacco causes cancer, great. But when it uses that scienticity to then say, well, masks are helpful, and here's what a model of using them would look like, then the presuppositions, right, that one, we're not going to do reparations, two, we're going to be okay if we end up with lower infections, but still with disparities. There's such a huge social imaginary that is truncated by them that they're almost, they're not useless. They're actually useful for perpetuating ideological power, but they're useless in terms of, I've worked in 6 outbreaks, never once used any models or any of the groups I've been working with, any models to change what we were doing.
Mark Bridger asks, this is, your work has been out there. Curious if there has been any response from IHME / conventional health metrics institutions to your work.
So none from IHME. I mean, one, but people that work there are like following me on Twitter, so I assume just to see what I'm saying. I mean, I've talked to people that work there, and they have the same view. They're like, this is not some kind of objective modeling output. When Chris asks us to do this, he'll say, I need more data that says this, instead of just where's the data kind of stuff. So, even internally, when you talk to people about how the dynamics of it, you do see that there is there's some pretty preconceived approaches going on, that are finding their way into the production. So my guess is the stuff is small enough now that it can be disregarded, but if it becomes more mainstream, I'd be interested to see their responses to like Tim Schwab's article in The Nation that started to really question what the Gates billions are doing. So far, nothing from them or from their higher up people.
All right, we're almost gonna let you go. He's super gracious here. Matt Bonds asks, related to Arthur's framing about how far upstream to go, I'm curious about your view, Gene, about being a professor, physician working within the constraints of the academic culture at HMS, and medical anthropology in peer-reviewed academic journals and institutions they represent. What is the path to radical social justice?
I don't know. I mean, I am co-opted all along the way, and often I have to get NIH grants to sort of pay my stuff, and that's not quite the work I want to do. But I'm a very lucky person. I'm probably one of the few people in the world that could be in a position to do this because of the house that Arthur and Paul and you guys have built, that allows for me to go wild with this critical inquiry. Much better, smarter people than me interested in this stuff have not succeeded at other places, and I've either had to go into industry or to like toe the line and do more kind of like ID, basic science research. And so I'm like lucky and thankful to be in a position I'm in. But yeah, it's not without like this book. I could have made it a lot more have appeal to the general reader, but there's sort of this, first book should be a little more scholastic if you want to, go up for tenure and these kind of things. And so I was conscious of making it a more scholarly endeavor than like a more polemic thing for general consumption. So hopefully maybe for my second book I can do that. But yeah, I do realize the constraints. I'm also luckier than most because of the position I'm in, and that's probably why I'm doing it. Like,
Applies to a lot of us. Let me ask you one more question. This is from Alicia Ui Amin. Congratulations, Gene. I love the book, as you know. As a human rights lawyer, sometimes human rights can be just another cave in the Warren, which also replicates the same paradigms of coloniality, neoliberalism in ahistorical/apolitical, but slightly different ways. Can you talk a bit about the Reparations Commission and how you're pushing human rights beyond its own comfort zone?
You read this one, right?
Yes.
Yeah.
Oh, before?
Yeah.
I don't think so.
No?
No.
Did I not answer this and say, Alicia, I love your work, and here's what I'm doing. Here's what we're doing with the Lancet Commission? Am I like totally tripping?
Could be me. I did get paged in the middle of it. Fair enough. Maybe that's the one that Paul read when I was at a commission.
Yeah, exactly.
Perfect. That would make sense then. Good. At least
Paul and I sorry, right.
Paul and I both agree it was a good question then. As were many. Good. We're at 151. Paul, do you want to have a final word or any final thoughts for Gene at this point? No worries. Arthur, would you like to have any final word for Gene right now?
Well, let me just say, can you hear me?
Absolutely.
Yeah. I think that's Gene is a provocateur, and but this is the best kind of provocation, and it's a provocation, really, in some sense, to public health and people's engagement with epidemiology as the basic science of public health to suggest that, maybe that basic science has got to be expanded in different ways we haven't thought about. So that even the kind of social epidemiology that Jean referred to, that Nancy Krieger does, is not nearly as broad an expansion as has to be done. And the question for them is, can it be expanded? Jean has suggested it can't, that there's something delimiting about this approach that doesn't allow it to go upstream. And so the second part of this is really the engagement with, I think, political science. So is there within political science an approach to power that could be married to public health and medical approaches that would give us maybe not the ideal, but something much closer than we have today, and therefore avoid becoming pessimistic. There's so many reasons to be pessimistic today. Just enduring the pandemic, we're looking for sources of optimism, and of course the Lancet Commission definitely will be one of those. But is this a potential source of optimism, Jean, to take more seriously measurements of engagement with and ways of understanding the way that power infiltrates society and our practices, and somehow scaling up a kind of set of methods that would be not ideal, but better than we have?
Thank you, Arthur. Paul, oh, sorry, Jean, go ahead.
Oh no, I said, yeah, that's fantastic. I mean, that's what I was trying to get at, that it's almost something like a supra-disciplinary concern where, if we say, Epi, all right, you're fantastic at getting some of the downstream stuff. Let's work with people who can talk about historical power, how that permeates, but then even taking it further, like, well, what are local interpretations, right? Like that, not dividing things so disciplinarily that we find a way to use all the tools together. I mean, the book itself, I do use Epi in some places. I use flash fiction. I use, fake ethnographies and logical argument and irrational argument. So I think opening up the space for what I was calling pluriversal knowledge production is the way to go. But right now we don't have that. We have, when you want to talk about the health and how health phenomena are distributed and how people are suffering, there's like one team to go to and one set of Lancet articles to cite. And to me, that's does more good than bad. I mean, does more bad than good. Sorry.
Paul, you wrote the foreword. We'll give you the chance to declare the afterword here.
I don't think there's going to be an afterword if it's the kind of book that I believe it is and hope it is, and said as much. This is a work that is meant to have a long life and stimulate discussion. I think for some of us, and for Jean as well, certainly his pragmatic side, the marker of real success is not going to be a broadening of editorial practice in the Lancet or any other academic journal. Just like, a famous Soviet era poet who is said to have read his poems out loud to someone he described as a peasant woman from a small village. These interventions have to pass a laugh test from people who have been left out of these jokes. Again, that's why I think this book is so serious, in spite of its carnivalesque approach or approaches. And I think that we'll be talking about it for a long time. So thank you, Jean, for opening up a very new kind of debate, I think, around methods than one we've heard in a long time.
Thank you, Jean. Thank you, Paul.
Okay, well, thank you, Paul. Thank you, Arthur. Thanks to everyone who sent in those thoughtful comments, and especially thank you to Jean indeed for really playing provocateur in a very serious way. So wonderful discussion. It's a wonderful book. Certainly encourage people to read it. So thank you all. We'll see you all next week for our next iteration of the seminar.
Thanks, Scott.
Thanks, everybody.
Everyone.
Thank you, Gene.
Appreciate it.
Thanks, Gene.